Hey guys, welcome to Hey Nurse, where the main goal is to impact one, change many. I'm Meg, and we're gonna jump into this video talking all about, do you have what it takes to be an ER nurse? I was an ER nurse for about 4.5 years before transitioning to my new role. And these are the top 4 traits that I feel like are definitely necessary or beneficial to be successful in the ER. So without further ado, let's get started. Number 1, the ability to be assertive, okay? So when we talk about the different communication styles, like there's the aggressive, passive aggressive, and assertive, right? And it's not just the ER where it's great to be assertive as a nurse, because you know, nursing, you have to be able to say what you need. You have to just be assertive, be firm about what you're saying sometimes, and then sometimes also in a compassionate way. So again, that's when it goes to that aggressive thing. You don't need to be aggressive where you're going off on your coworkers or patients, but you do have to assert yourself to take care of patients, and also sometimes dealing with coworkers. So being assertive, that's a part of like advocacy. And if you need to maybe go to the doctor on behalf of your patient, you know, you notice that you're waiting on orders, okay, well, you need to be assertive and go get what you need, you know. Or if a better patient assignment is what you need, then you have to be assertive and go say that. Sometimes when it comes to certain things with a coworker, you may have to be assertive in conflict resolution with coworkers. So I feel like that style allows you to say things to other people without violating that person or other people's rights or feelings and whatnot. So but it gives you the freedom to stand up for yourself. And then so to the other styles like passive, I feel like if you're passive, definitely you're gonna get walked all over, okay? And especially because they have some folks that will take advantage of people, again, maybe on the co-worker and the patient side. So being passive, that's not the best thing. And then passive aggressive, I almost feel like you're on a roller coaster, because it's like you're letting things slide, but then you're not really, and then you're holding it all in and then having these big explosions at work. That's not solving anything. Or, you know, if a cold situation happens and you're mad about something from a while ago, and somebody say the wrong thing, and then all that built up anger comes out in that moment. That's not good, you know. So it's better to be assertive about situations and needs, definitely in the ER. Number 2, being adaptive, okay? That is critical. You don't know what's coming through the door. You could just get your room assignment, and when I say room assignment, meaning that the number of rooms you may have in that day. So maybe you have room or pod A, and those 4 rooms that's in it, or however they label it at the facility. But you may have your room assignment situated, everybody's in bed, they have their medication, they're fine, they're waiting, you know, waiting either to be discharged or admitted. And then next thing you know, it seemed like everything happened at one time. You get one discharge, and then you get a new patient in the room, another patient ready to go up on the floor, another patient is in AFib, RVR, and it's just a hot mess all in 2 seconds, right? So you do have to be able to adapt. And then, you know, I know some people is like, no, I need that routine, and when change occurs, like it's like a block in their head, like, wait, I don't get it. But no, it's definitely necessary. Like when situations arise, again, like I said, you don't know who's coming through the door. You may have a client that's dealing with some mental health concerns that can come and be in your room and have various things going on. It may be someone having an anxiety attack. It may be someone going through delirium and trying to climb out the bed, and then you need to go do blood cultures and whatever else. So it's just a lot that kind of happens, and you just have to be able to go with the flow sometimes. And even like changes in your client condition, you know, maybe they started off stable, but then something's going on, and then now they're unstable. So like you need that ability to adapt to those things, because I feel like being unable to adapt will like block your understanding of what's going on in that current moment. You know what I mean? It's like, wait, but they were fine 2 seconds ago, and wait, I don't understand what happened. You don't even need to be thinking about that. You need to get them stable now. You know what I mean? So again, consider that. If you know you somebody who's like, I like routine, I don't like things being thrown at me, I like to know what's going on, yada yada yada. Well, consider certain areas where you do have more of a routine with people, and not that different things may not occur, it just may not be as frequently. So the ability to multitask is number 3. Okay, so again, as I just mentioned about like all those changes, well, to deal with those things, you do have to be able to multitask, right? So it's that, you know, if a client comes in, I'm putting you on the heart monitor while talking to you and assessing what's going on, what brought you in, you know, are you having chest pain, when did it start, blah, 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 blah. I'm also now, you know, I tell you that, oh, we have to draw blood too. So as I'm drawing the blood, I'm still talking to you. So you talking and doing, you're kind of thinking and anticipating orders that may come up, and whatnot. If there's something that you need to go communicate, is there somebody that you need to call? Like the patient say, oh, my wife was supposed to be on the way, or oops, I left the medication at home. Call my wife and ask her to bring it, or whatever it may be. But just being able, you know, if you're drawing blood, maybe you can tell somebody out the room, hey, can you bring me a phone, or whatever it may be. But that ability to do more than one thing at a time will definitely be beneficial. And one thing I'll say about that, you don't have to start off able to do it all at one time, especially for newer nurses or the novice nurse. You know, you're still learning how to get your skills, and you know, the skill part is one, and then the communication side is another. So to merge those two, it really takes experience. So if you don't have that to start with, it doesn't mean that you can't do ER. It just may be a challenge that you have to overcome, and something that you actually practice at getting better at. All right, number 4, which is the final one, is the ability to let things go. Okay, again, you are dealing with maybe type A personality in the ER, where again, these people are straight up, they not sitting there holding their tongue back for you, they gonna tell it like it is. So you can't be a little crying Miss Sally over that, you know, because people ain't got time for that. Things are hustle and bustle, especially, you know, at a time like right now with COVID going on, like things may be a little stressed and whatnot. So people don't have time to be trying to find the best words of communication at the time. They're going to say whatever it is that they feeling and thinking in the moment. And sometimes that stuff is not meant to be taken personal, you know. Some things, yes, you need to address, and of course, like I said, be assertive about. And then some of that stuff for your own peace of mind, you have to be able to let that go. You know, go with the flow, roll with the punches, let some of those issues go, because otherwise you'll drive yourself crazy. You know, for instance, if something happens in a code and maybe somebody didn't practice closed loop communication, which is where, you know, you're supposed to give information, they're supposed to basically confirm it back, and it's supposed to have this nice, respectful environment, yada, yada, yada. But sometimes when people are rushing or a little flustered, again, you're not thinking, the best way that I can say this to so-and-so, you know? You saying, hey, I need you to bring me those blood cultures now. Bring me the blood tubes and IV kit. You call respiratory. I need this, and that. Like, you're going to have people shouting orders at you. I need you to get open up the code cart. Like, it's going to be in your face, you know? And not that, I don't want to make it seem like, you know, like say like the trauma room is like this big scary thing, because a lot of the codes that happen were smoother, but it is still people saying what they need, you know. And then so somebody's like, I didn't like how you said that to me. Again, sometimes some things you address, some things you got to just let go. For your own peace of mind and your own mental health, it's better to let some things go. I hope you enjoyed my 4 must-needed tips to work in the ER. Tell me if you agree or disagree. You can leave a comment below. I would love to know your experience as to what you felt like really was like the thing, like, oh yeah, this one skill that I needed or one tip that really got me through being an ER nurse. And if you're interested in going to the ER, let me know that too. I'm willing to do future videos on it. Make sure you subscribe to see those videos, and I'll catch you on the next wave.